Gibney. He's a co-chair of the Edmonton Zone Medical Staff Association's Strategic COVID-19 Pandemic Committee. Doctor, thank you for your time. Can you explain why Alberta is in the situation it's in right now?
Thank you for having me. Well, we're in a situation, to put it in context, where not only does Alberta have the highest rate of COVID on a per daily basis by population in Canada, but also of any state in the United States, which is an astonishing situation to be. And I believe we're here because our government hasn't taken the necessary steps. That the messaging that we've received is mixed, where on one day the Premier is suggesting that lockdowns don't work, and the next day suggests that we're going to have to bring in new targeted public health restrictions. I think we need strong messaging, and we need strong measures.
Are cases likely to go higher in the interim then?
There's no question that until new strong measures are brought in, that the rates are going to increase exponentially, and we can expect a doubling of our cases over the next 2 to 3 weeks.
I'm sorry, a doubling of cases, Doctor?
A doubling.
That's hard to absorb and shocking. So what I'm hearing you say is the targeted restrictions Jason Kenney implemented last week aren't near enough.
No, not at all. We need to at least go back to the measures that were in place in Alberta during the first wave in the spring of last year. Alberta managed that wave incredibly well, with very few cases and very few mortalities compared to other provinces. And we're now on the other side of that, where Alberta is managing this third wave very poorly, and our case rate is significantly higher than any other province or any state.
So what do you think, Doctor, when you see the number of people attending a rodeo like they did in Bowden this weekend? What would you say to those people?
Well, I mean, my reaction is that I'm just profoundly disappointed and concerned. And that even though it was outside, with most people unmasked, this has the potential to accelerate the spread. I think that the message has to be that, this kind of action is just going to accelerate the rate of spread, potentially infect people's families, friends, co-workers, and we simply have to get this under control. I mean, there is some good news here in that with increasing vaccination over the next couple of months, in all probability, this will be controlled by the end of June, possibly into the middle of July. But after that, we can expect a new normal. And ideally, we should have as few people get sick and die as possible, because if this continues, by the end of May, inevitably, we will have overrun the healthcare system in Alberta with a very high mortality and morbidity.
Dr. Gibney, the Premier did, in essence, via a series of tweets, and we've got one we can pull up here, told those people to just smarten up. But those tweets happened after the event was over. There really didn't seem to be anything to back it up. Are you suggesting he implement a full province-wide lockdown?
Yes, I think there's no way to do it in any other manner. I think it has to be strong, it has to be unified. And I think that the concept of, on one hand, trying to appease the individuals who are anti-lockdown and believe that COVID is a hoax, and at the same time control COVID, they're simply not compatible. We have to have a single strong message, one approach, and get on with it and stop this spread at the rate that it's happening currently in Alberta.
Dr. Noel Gibney is a co-chair of the Edmonton Zone Medical Staff Association's Strategic COVID-19 Pandemic Committee. I appreciate your time today. Thank you.
Thank you very much. Bye.